Today we'll take a look at Jennifer Aniston throughout the years and see which facial plastic surgeries she may have had done. Stay tuned until the end when we reveal the total price for all of these procedures. In 1994, at the age of 25, you can see that Jennifer has a nice rounded hairline. This is considered more of a bell-shaped type of pattern. She has nice youthfulness by her eyes. You can see that she has superbrow fullness. She has a nice smooth transition between the lower eyelid and the cheek. She also has these perfect looking teeth. I'm not sure if she's had veneers or not. She has strong nasal cartilages. She also has a nice lip ratio where the lower lip is slightly fuller than the upper lip. You can see that Jennifer has a lack of philtral column definition, and when it comes to filler for that location, just as a side note, what people often do is they place filler into these philtral columns to try to give it more definition. But the problem with that approach is that what happens naturally with a well-defined philtrum is that the central aspect is actually more indented or concave. So it's not that the philtral columns need to be built up, but that central part needs to be brought in, which is very difficult to emulate. That's not what Jennifer has had, but I figured I would teach you guys a little bit right there. In 1995, at the age of 26, I can see a change in her brow aesthetics. She now has a thinner appearing brow. The problem with overplucking is that eventually over time you can actually have loss of the eyebrow hairs, and that's why some people end up coming to me for eyebrow hair transplants. Jennifer also has a relatively flat upper lip architecture with, like I said previously, good lip proportions. So what I mean here is that her upper lip is more oriented flat. And so I talk about this a lot with my lip lift surgeries, that when you do a lip lift, oftentimes you're getting more arching that occurs. So when you start with a flat lip, that's actually a good starting point for someone who's interested in a lip lift, because then you get a nice arch to it. When someone is starting out with a very arched upper lip and you go ahead and do a lip lift, you can sometimes overarch them. So that's something to be careful of. Jennifer also has a strong chin. In 1996, at the age of 27, I'm not seeing any changes. In 1997, age 28, no change. But notice in this photo how naturally the left side of Jennifer Aniston's face is her dominant side. We all have a dominant side when you look closely. And so when you look at her left eyebrow, it's sitting higher than the right. The entire eye socket on the left sits higher than the right side. Her cheek is fuller on the left than the right, and also you can see with just the strength of the smile, and you can see where the nasolabial fold is on the left, how it's just her stronger side. The muscles on that side are stronger. So that's something interesting, and that brings us back to facial asymmetry being a very normal part of facial aesthetics, and we have a video that goes into this in much more detail. In 1998, at the age of 29, I'm not seeing any changes. Same in 1999, and in 2000, at the age of 31, what I'm starting to see is that Jennifer is starting to introduce lip filler, and you can see that the proportions are starting to change. The upper lip is becoming fuller. That ratio between upper lip to lower lip is starting to get closer to a 1-to-1 ratio. In 2001, at the age of 32, I'm not seeing any further change, and same in 2002, 2003, and 2004. In 2005, at the age of 36, what I'm seeing here is that I think Jennifer has had a chin reduction. This has shortened her lower face. So she had a very prominent chin that was elongated in youth, and now it's been brought in and it's more in line with the rest of the jawline. And this is something that appears to me to have been surgically done. The most common way to do chin reduction surgery is to either make an incision under the chin area here in a crease called the submental crease, or to make an incision on the inside of the lip, basically from the inside of the mouth heading down towards the chin bone. Once you're at the bone of the chin, then you need to usually rasp down or burr down that bone. So meaning reduce the actual bony volume of the chin in a nice controlled way that makes it blend in with the surrounding bone of the rest of the jaw. And once that is complete, then you have to close the incisions, either the internal mouth incision or the external under the chin incision, and that completes the surgery. When deciding which surgical approach to take to get to the chin, you have to consider what it is that you're going to be doing for the chin. So in Jennifer's case, if she was having a reduction of the bone, it's okay to do an intraoral approach because you're not leaving a foreign body in there, so there's no major risk of infection, especially in a kind of a prolonged long-term type of situation. But if you're putting in a chin implant that's going to stay in there for a long time, then usually it's placed from an under the chin type of approach because you're less likely to introduce infection, since the mouth has a lot of bacteria. And if you were to put the implant in through the mouth, it's going to carry a lot of that bacteria through into the actual surgical site, and that could cause problems down the road. So in Jennifer's case, for a chin reduction, she likely had an incision from the inside of the mouth. In 2006, at the age of 37, what I'm starting to see is that Jennifer is starting to use some Botox here. Forehead, glabella, crow's feet, sort of the usual areas of the upper face have some Botox in them, and this is a conservative use of Botox in that she's not really fully paralyzing those muscles, because you can still see some lines, but they're less significant than they were previously. In 2007, at the age of 38, it looks to me like Jennifer has had a rhinoplasty. You can see a more refined tip. The lateral wall, especially on the right hand side, looks a little bit indented. The bridge is more narrow, and the hump has been reduced. And she has admitted to having had a rhinoplasty in the past, and actually she said that there was a revision that she underwent, and so I believe that the first rhinoplasty was much earlier in youth, because when you look at photos of her when she was like a teenager, there was more of a bulbous tip, and so I think that was addressed with maybe a septoplasty years back, and then she had this revision. And when you compare this photo here to the one in 1999, you can really see the difference, especially in the width of the nose and also some of the three-quarter view changes as well. In 2008, I'm not seeing any further changes. In 2009, at the age of 40, it looks like Jennifer is starting to introduce some cheek filler. Her cheeks just look more filled out from the medial aspect going out into the lateral aspect as well. In 2010, age 41, no change. Same in 2011 and 2012. Please make sure to subscribe to this channel. In 2013, 2014, and 2015, still no changes. In 2016, at the age of 47, you can see that Jennifer now has a fuller eyebrow look. So she's starting to grow back some of her eyebrow hairs and not pluck in certain areas, and this has led to a fuller eyebrow appearance, and something that's become more popular these days. From 2017 at the age of 48 all the way to 2022 at the age of 53, I'm not seeing any further changes that have occurred in Jennifer Aniston's appearance, which is pretty remarkable. She's aging very well. So the total cost of all of these procedures is $160,000.